Good morning, ladies and gentlemen. I'm Ramu Damodaran with the United Nations Department of Public Information. Thank you for joining us at short notice for the briefing this morning. I think all of you have been following the Ebola story and also Dr. Nabarro's personal involvement with it. Dr. Nabarro has been with the United Nations and before that with non-governmental organizations, both at the physical front lines of danger. He was in Darfur, he was in the Canal Hotel in Baghdad when it was bombed in August 2003. He's worked on issues for the United Nations ranging from the avian flu to the tsunami in 2004, to food security, and now to scaling up nutrition, one of the Secretary General's most recent initiatives, and now as Mr. Ban Ki-moon's special envoy on Ebola. I personally first heard of Dr. Nabarro almost 10 years ago when I was in South India, the day the tsunami struck in December 2004. And a lot of the newspapers in Kerala thought that Nabarro was yet another UN acronym. They didn't realize it was an individual, they thought it was an institution, and he may well be. Newspapers in India then went on to actually expand the name Nabarro, and one of the journalists whom I knew at that time said it could be expanded to new awareness brings alarms, risks, reason, opportunity. And if you think of that in the context of Ebola, it fits in so well because our new awareness of where this disease, in a sense both geographically limited and yet unlimited, limited in terms of its severity and yet unlimited, with, as was once said, the worst about to be, that new awareness brings alarms. But those alarms lead on to risks, which those at the front lines, the courageous aid workers and the United Nations itself then confront. And from that come reason, building upon scientific knowledge, scientific awareness, and the possibility of change. And finally, the opportunity, to quote Dr. Nabarro, that the legacy of this terrible illness will be better health systems, a greater social conscience the world over, and, in a sense, our ability to move to a 21st century which is really worthy of our times. I would also encourage all of you who were watching us on webcast to please send in any comments and questions you have. Jeff Brez, Chief of our NGO Relations, is here with us, and he'll be monitoring these and passing on those questions to Dr. Nabarro. Our Facebook is DPI, UN DPI NGO, and our Twitter hashtag is DPI NGO. So please do that, and after Dr. Nabarro has shared his initial thoughts with us, we'll really open this for a free-flowing, no-holds-barred conversation, which he has kindly agreed to take part in. Sir?
Thank you very much indeed, Ramu. Hello, everybody, and thank you for sparing the time to join this morning. I'm very pleased that we are webcast, and I understand that that means that questions and ideas can come in. We can also keep the conversation going after this session. We will make certain that if questions come in afterwards, my colleagues Rebecca Affolter and David Simpson will be fielding questions and comments. And always, if it's useful, my email address is nabarro@un.org, very simple, and don't hesitate to email stuff as well. I'd like just to make a few remarks. I'm really pleased that this dialogue has been set up. I think that the key requirement from my side is to be able to listen and understand some of the concerns that you'd like to raise. So can we make sure that I'm brief? And Ramu, if I go on more than 10 minutes, I hope you'll stop me. Just turn off my microphone. That'd be the easiest way. There are many groups who have been working in the most acutely affected countries and beyond to engage with governments and to engage with communities on the response to Ebola. Actually, I think this is the most extraordinary mobilization around a health issue that I've ever seen. I reckon perhaps 2 or 3 billion out of the world's 7 billion population is in some way emotionally engaged. And I think hundreds of millions of people have become directly involved through the work of different civil society groups and through participation through the Red Cross movement or other movements. And for those of us in official positions like myself, it's really important to recognize that we are a tiny piece of the issue and the response, and that we can, through being intergovernmental officials, be useful to all of you and your constituents in acting as a conduit for your concerns and your interests. One of the things that I've learnt about this and other outbreaks is that although they are about disease and illness, they're much more than a health issue. I remember in the 1980s when we were involved in the shores of Lake Victoria with the emergence of HIV, recognizing that that was not just a health issue. And that's been the case with many other disease challenges on which I've been involved, that it's become an issue that is deeply affecting society, economies, government, and also many aspects of global affairs that are way beyond what the ministries of health and health professionals are responsible for. Yet the health professionals are at the center of the response. So they're the primary agents. But they're finding that it is presidents and prime ministers who are deeply engaged. And it's that breadth of the issue that makes it so important to all of us, and means that those of us who are working in the health sector need to be ready to engage with others who will perhaps have a different view on how things should be done. There's the additional issue that many of us are now encountering on this health issue, that those who are at risk of disease and those who are diseased are somehow being stigmatized or being subject to various forms of discrimination. And that happens within the home, it happens within the county or the district or the prefecture, it happens within a continent, it happens globally. And many of you know about that and have read about that. And so I think that it's really important that all of us understand the roots of the fear around this disease and the roots of the stigma and work to address it. So we're all in this together, our organizations, and the partnership between us is one on which we all need to build. A month ago I spoke with the General Assembly here, and I said that in all my 35 years in public health, I've never been involved in a disease outbreak as challenging as this one. And that's still true. Although we've got some signs of positive progress, they are small signs. And there's not, at the moment, enough certainty about what is happening for us to be able to say that we know the trajectory towards the end of the outbreak. The signs are that in parts of West Africa where the elements are put in place, where communities are fully involved in the response, there is a slowing of the outbreak, fewer cases appearing each week. And that's, I think, a real source of inspiration. But there are other parts of Liberia, Sierra Leone, and Guinea where transmission is still fierce, where there are many new cases emerging each day, where there are difficult hotspots. And that's really pushing us to redouble our efforts everywhere to respond. And that's pushing the United Nations, it's pushing governments, it's pushing civil society groups to sustain it. And in order to do that, we have to continue to have capacity for treating people who've got Ebola, to have good quality case finding and contact tracing, and also to continue to ensure that essential services for healthcare, for food, for protection of children and other requirements are kept in place. So that's maintaining the response. And we need in particular to be flexible in how the response is delivered, so that when there is a hot spot that emerges, it's possible for the responders to be moving to where the hot spot is and to be supporting the people and the responders so that they are fully effective. The second point I want to say is that there are important changes in people's behaviors. Communities are recognizing what they need to do to stay safe, safe burials, safe ways of relating to each other, reducing physical contact with those who are sick. And community leaders, local civil society organizations and governments have all led that. I myself have watched as communities are taking responsibility for this. So, expanding the response and at the same time mobilization of communities is showing promising results. But I'm afraid we have to keep going till the last person with Ebola is under treatment. So let's just, in my conclusion now, be encouraged by the progress and build on it. Let's maintain the effort to the situation where transmission is dropped. Let's recognize that essential services are being undermined and work for those essential services. Let's invest in recovery so that countries can get back and be on their full path towards development. And I'd like very much to hear from you how you believe we can do this together, and to hear any concerns, comments or suggestions that you might have. Thank you very much for the chance for this briefing.
Thank you very much, sir. And as Dr. Nabarro has indicated, the floor is now open not just for questions, but for your own comments, perspectives, ideas, suggestions. So please, Richard, please. Yeah. If you could just identify yourself, please, everyone, I'd be grateful.
Thank you, Ramu, and thank you, David. Richard Jordan from the Royal Academy of Science International Trust. At the fall meetings of the World Bank, the Secretary General, the President of the World Bank, and the heads of state of the three most affected countries all got together for an early morning briefing. Do you want me to start over, David?
No, it's just I'm half deaf. Oh, well. Sorry.
So it's the World Bank annual meetings. How has the plan that the Secretary General and the World Bank President and the three heads of state put into effect, how has that been implemented? Thank you very much.
Thank you very much indeed. You were asking, I think, I have to say, Ramu said that I was in this incident in Baghdad, and I just have got a bit deaf, and this is a really difficult environment acoustically. So if anybody knows how this system works so that it's possible for me to hear through the headphone, that would be super kind, because at the moment I can't get it to work. And so what I want, you were asking how the plan that the Secretary General and the President of the World Bank was discussing when they met together last month in Washington, how that plan is being taken forward. And could you just say what particular parts of the plan you would like us to comment on? And then I'm going to suggest several questions taken together, but I'm very keen just to hear what part of the plan would you like me to comment on? The supply chain of people or the supply chain of... getting medication, let's say, through the system. Okay, thank you. Could you just talk again, see if I can hear you through the through the earphones?
Yes, is that working for you now?
Yeah. So how are supply chains working in particular?
And David, maybe I could modify that by saying digital. Is digital communication helping in that respect?
Yeah, thank you. Okay, Ramu, I suggest we take a number of comments just to facilitate things. Now I'm in good state now.
Thank you. Padmini, Dr. Murthy? Just wait for it to turn red, Mini. Thank you. Thanks. Right.
Thank you. Thank you so much. Sorry about that. I just would like to say that as a physician and a public health professor, it's of great concern because the American Public Health Association annual meeting is going to start this weekend in New Orleans, Louisiana, and the governor of Louisiana has issued an executive order that nobody who has gone to the West African countries can come. And this has caused great concern for us because we have a lot of colleagues who had to withdraw at the last minute. So my question to you, sir, is what can we do to make people understand, especially the policy makers, that these kind of decrees, when these people have tested negative for the disease and have been back in the US for the past 2 to 3 weeks, are really, unconfounded, and there's no reason or rhyme, and it's really harming us. Thank you so much.
Thank you. Please.
Hi guys, my name is Alexandria Fitzgerald. I'm a youth rep for DPI, representing ECPAT USA. Dr. Nabarro, I just want to say I really appreciate you touching upon the stigmatization. I think that is a major effect on society today and how your everyday person is looking at this disease. I would like to know, are there any sort of campaigns or collaborative efforts to combat this negative outlook?
Yeah, great.
Thank you.
Thanks, Alexandra.
Is there anyone else here? Please, yeah.
Put your hand up, right up high. When it's red, it works.
Is it my turn?
Yeah.
So the gentleman over there is...
Okay.
Okay, right, you start then.
Okay, first of all, my name is Yohei Suzuki. I'm one of the representatives of the New York Metropolitan Martin Luther King Jr. Center for Nonviolence. Thank you very much for a wonderful presentation. My question is, I'm wondering, because ever since the the concern about Ebola was publicized on TV. It was announced on TV. I think it has been started to impact negatively on the economy and business communities of New York. For example, groups of tourists decided not to visit New York, decided not to visit America because of the huge concern about an epidemic disease of Ebola. So how should we should the UN or government should deal with the issues about great concerns about that might impact the economy at the national and the global level?
Thank you. Thank you very much, sir. Just raise your hand, sir. Thanks. Yeah. So that they can see you. Yeah. Okay. Yeah. Go ahead.
Let me first of all take this opportunity to thank Dr. Nabarro.
Just identify yourself, please, sir.
I am Franklin Fawundu, counselor from the Sierra Leone Permanent Mission. Let me thank Dr. Nabarro and Mr. Tony Bambury for the great work they are doing back home. I must state that as a country, we were initially unified in a fear, but that fear has been allayed since the inception of UNMIR. We believe we are a nation that can persevere, and we believe Ebola will pass. But I have a few concerns that I may want to raise with Dr. Nabarro. Firstly, we've realized that there is no unified message coming out in terms of giving statistics, data, and updates on the current figures. And we also realize that women are not included in most of the activities that is going on in the fight against Ebola. And we all know when these scourges arise, mostly women bear the brunt. And thirdly, I will also want to make a personal request that we think of post-Ebola. We are not looking at the situation as it is now, but we put in place mechanisms that could be sustainable in the future. Because like I said, Ebola will pass. Will our health systems be well prepared for eventualities? These are my concerns. Thank you.
Thank you so much. I think we'll take that cluster, sir, and then we'll have questions coming online with Jeff Rusher after you responded to these.
Wonderful. First of all, Richard Jordan from the US Academy of Sciences. Good morning to you, Richard. I think the special feature of the response has been that the whole of the UN system has come together as one, and in that regard it's wonderful that Jim Yong Kim, the president of the World Bank, has linked up in the fullest possible way with the United Nations so that we don't have two separate processes, we have one. And in that regard, President Kim has indicated that he will firstly ask the World Bank directors to put money straight into the governments of the affected countries, what we call balance of payment support, and also with Donald Camaruga, the president of the African Development Bank, they have offered sector support, for example, to the health sector, so that there is not any constraint in country to resources being spent. It took a bit of time to get these things in place, but it's now very much the case that there is funding moving through the governments and enabling health workers and other responders to get the resources they need. I'm super pleased about that, and I'm sure that this is being appreciated by the presidents and by the ministers of finance of the concerned countries. Secondly, it's good that within the UN mission that the World Bank has provided some resources, particularly for the World Food Programme, to initiate a logistical operation that is getting supplies out from the capitals at the control of governments to more peripheral areas. World Food Programme is doing this on behalf of the whole system what they call a special operation, and we've been able to put some money into that also from the Secretary General's Trust Fund, supplementing the money that's been provided by the World Bank. Thirdly, the President of the World Bank in Accra a few days ago undertook to provide some resources to improve the movements of people, particularly the people coming from other African nations, to provide support. That work is still being put in place. It's not quite functional yet, but it will be functional very soon. And fourthly, your comment about digital communications is hugely important, and it's great to see that, again, through the work of different intergovernmental bodies, that there is an effort to improve cell phone coverage and other communications capacity in the affected countries. It sometimes feels that these things take some time to get in place after they're announced, and I'm more frustrated than anyone else is that it takes time to happen, but it's quicker than in most other settings. Richard, if you hear that things are not working as they should be, please blow the whistle and tell me, and it's exactly the same as our colleague Franklin from the mission. They get information that often leads them to question when we say that things are working, and so don't hesitate to give me the information if we need to do more to unblock things on this. To Dr. Padme Murthy, namaste, and thank you for your remark. You know, about 80% of the economic and social consequences of this outbreak are because people are frightened about it. And I've been looking at some of the economists' analysis, and they say if it was possible for those of us in public health to get the truth across about the risks of this disease, then a lot of the social and economic consequences would be reduced. What I've noticed is that the initial response of many, including my own family and friends, the initial response is an extreme response. You know, if you have traveled recently in an affected country, you are yourself a potential transmitter of the virus. And that was the same also with HIV. It was the same with pandemic influenza. And so what I like to do is to listen to that initial response and say, well, can I have time to sit down with you and go through what we know about this disease with you, so that you can perhaps then rethink your initial response and develop a more measured one. And so what I'm suggesting, Dr. Murthy, with everybody is to engage with those who are reacting in extreme ways, not to attack them directly because they just go into their shell, but to engage with them. I understand your fear. Now let's think about how that fear can be reduced. And situations like we've seen recently with Craig Spencer, who was just discharged from Bellevue yesterday, are very helpful in reducing some of that fear. We also need to remind people that this is a disease where transmission is through contagion. If Ramu is healthy and I have Ebola, even if I'm secreting the Ebola, if Ramu is if you're about 2 yards away from me, that's okay. You're not going to get it. If, on the other hand, I come up to you and I hug you like this, and stuff kind of gets from my body into yours, then you're at risk. But that's the truth. You have to be in close physical contact with somebody to get the disease. And by close physical contact, we really mean body fluids must go from me to you. And so let's remind everybody that it is spread through contagion. It's not spread airborne. Of course, governors and others have a responsibility to protect their people, but sometimes we can help them to do that responsibility in a way that is fair. I hear even of UN people being prevented from traveling, UN people from Sierra Leone who get stuck in airports for 24 hours, treated as though they're criminals. That's the worst. And so I think all of us, each human being, has a role to try to reduce the stigmatization and to recognize that it is really unfair. It's really damaging to the countries when this kind of behavior is done. But I don't want to say I'm being critical of any individual, because I'm not. To Alexandria Fitzgerald, in a way your question was the same. Could we possibly make this a campaign? I was very pleased to see on Facebook and also on Google now that there is a button for donation. But I'd like to suggest, and I'm not quite sure where the right place to suggest it is, so I'll suggest it here, that we have a second button on these sites, which is a button of solidarity, where everybody shows their solidarity for communities affected by Ebola. Everybody commits in that solidarity that they will not stigmatize, that they will not discriminate, that they will receive and warmly welcome people from the countries into their homes, into their spaces, because they know, we know, that this is not a disease that is transmitted through any other technique than contagion, and you are contagious if you have symptoms. So let's try to use social media to express solidarity and to show that we are anti-discrimination. We've done it for HIV, where it was particularly necessary. We must do it urgently for Ebola. And Alexandra, it's super that your group is interested in doing this. To Johnny Suzuki, I can't fully understand why people would say we're not coming to New York or the USA because there has been some Ebola. That is really extreme. I want to encourage everybody to maintain travel, tourism, even to places that have Ebola. There is just no reason not to go. I find I go to Freetown, I go to Monrovia, I go to Conakry. These are cities which have got fabulous places for tourism. They're unfortunately not very full at the moment. I would like to encourage tourists to go to these countries. I'd like to encourage business people to continue working with these countries. There is no reason not to. We are dealing here with countries that are vibrant and alive and recovering, and I want to encourage travel and tourism to these countries in a very public way. It's just not appropriate to say, don't travel there because there is Ebola. If you're going to get Ebola, you will get it through being in direct contact with somebody, and that is mostly avoidable. And the other point that I would stress is that we are seeing that if people are identified with Ebola very early on, they have a very high chance of recovery. So I'm really encouraging, maintain the contact, maintain the tourism, maintain the travel. And to Franklin, yes, I think we need to be thinking of post-Ebola now, and we need to be working on economic recovery now. We need to be working on the recovery of agriculture and food systems now. We need to be working on ensuring that we can get the airlines back now. The longer that this process of isolating countries that are affected by Ebola goes on, the more damaging it will be. I also want to stress that in Sierra Leone we've got big involvement of women's groups. Women healers have come forward and said we want to be part of the response. The President's advisor on gender has been leading a campaign to get women's groups more involved in the response, and she also has been here. She was here during the UN General Assembly. So thank you for stressing that, and keep an eye on us, Franklin, to make sure we do. And lastly, if there's not a unified message on statistics, it's my fault. And so, because I have been asked by the Secretary General to try to make sure that we are unified, and we are doing our best to get that right. We've had some slight slippages because projection figures got out, They were planning projection. They were not projections for any other purpose. And it was unfortunate that they were seen to be actual predictions. And there's a huge difference between planning projections and predictions. But we are trying to get that right, Franklin. And please keep an eye on us. If you see a mistake, let us know. Let's keep it going now. More comments, please. Thank you, Ramu.
Jeff, we have some questions online. Thanks.
Can somebody give Jeff the mic, please? We're losing time. Jeff is down on my left.
Thank you very much, and thank you to those of you who sent us questions via social media. I have 5 questions in the queue. Some of them very much related to the discussion that's already gone on and the information that's been offered. The first is very specific. Is the UN planning to build a treatment center in Kabbalah, Sierra Leone? The province of Kouinadougou just had its first case. And related to that, is there a plan in Sierra Leone and affected countries for dealing with orphaned children resulting from the epidemic? Second, one tweeter is likening the response to the HIV/AIDS response by the UN and calling it slow and ineffectual. Third, by the UN. Third, the question is, the media portrayal appears to me to be causing unnecessary panic among the public across countries in the world. What can be done to counter the media that is causing panic through the way it reports? The fourth question, what are the most effective prevention and problem-solving roles for NGOs and CSOs in Africa? And the final question is, do you think that the quarantine adopted by the states of New York and New Jersey in the United States is effective in protecting the public? Thank you.
Thank you, Jeff. Sir, please. Yeah.
Yes. My name is James King. I represent the Olaf Palm Peace Foundation International and the Ansaranko Nana Yabani. 2 of the questions that I had were already stated, but I'm going to restate them again because they are a concern, you know. When the government has put mandatory quarantine in effect in New York and in New Jersey, what happens when people come here, you know, I mean, this is one of the things that relates to your issue when you said that it affects marketing and, yeah, tourism, right? The other thing that, Dr. Nabarro, you mentioned that essential services were being undermined. Can you please elaborate on that? And the third piece is the media actually getting accurate information as to how Ebola is transmitted? And are they relaying that information to the public accurately? Or is there something else in the mix there? All right. Thank you.
Thank you. Thank you, Mr. King. Anyone else before? Please, sir. Yeah, just. Yeah, okay, yeah.
Hello?
Yes.
Okay, my name is Modu Cham from World Information Transfer. And I have one simple question. I think it was asked, but it wasn't answered. Can you speak on the aftermath of the Ebola outbreak and investments in building better healthcare infrastructure in developing countries? Thank you.
Thank you. Please, ma'am, please. Yeah, thanks. Mm-hmm.
Hi, my name is Keri Toko, and I represent Augustinians International. And my question is pertaining to diseases in general, because I have seen, and I think the sentiment has been that because Ebola finally crossed the border of Western countries, but especially America, it has become front page news, and therefore that's why a lot of these efforts in finding cures and treating it have been very active and proactive. But are you finding that, for example, for diseases such as malaria, which are still quite rampant in African countries, there are also movements to deal with them apart from obviously the Ebola crisis that is now knocking on our doors.
Thank you. Had about 9 questions there. So.
Thank you very much indeed. Is the UN planning to build a treatment centre? I think it was Kampala. I'm just checking out on my, I'm on my computer at the moment, is just checking through the plans. I want to stress that what we're trying to do together with the government of Sierra Leone is to ensure that wherever new cases emerge, as in Kabia in Sierra Leone, that there are community care centres being established, and I will check and actually try to find a way to inform you the answer to your question. And it may be that I need to look again at the actual question itself. So that's something that we will deal with afterwards because it's a factual thing. What are we doing about orphaned children? Answer: many non-governmental groups and UNICEF are fully involved at the moment in trying to respond more effectively to orphan children through child protection, and that is a big priority. We will be addressing that. I have a meeting tomorrow on that. So yes, it is a very much part of what we're trying to do. Slow and ineffectual response of the UN. Well, I got involved in this on August the 11th, and I can only comment on really on what has happened since I got involved. And I must say that the organisation of the United Nations and all its different parts has been totally consumed by responding as quickly as it can to Ebola. I think that there will always be some questions about whether we've done it well enough, and I encourage all of you to comment on that and to call for inquiries or whatever else you think is necessary. But in the time since I've been involved, from the Secretary General across all the different agencies, we're doing what we can to try to be as rapid as possible. Don't hesitate to write to me if you see signs of slowness. Help me, because we will do everything we can to try to react to your news and to your comments. It's difficult sometimes to get all the different parts of the UN moving at full speed, but I do want to get your views whenever it's appropriate. The media themselves are causing panic. Well, it's difficult information for all of us to cope with, some of this. It's new stuff, and there is fear at many different levels, fear in people's households, fear in people's communities, and we've talked about some of the discrimination and stigma. All I'm saying to you is that I believe that, as with any new piece of information, we need to have plenty of opportunity to discuss, debate, rethink it in your universities, in your schools, in your organizations. Try to keep it cycling along so that the first information is not the only information people can have. The role of NGOs and civil society in prevention and problem solving, it is central. Anything that you and your organizations can do to encourage debate and discussion and to enable communities to embrace and own the issues is so important. You know, health challenges in the world today are not solved by doctors and nurses. They are agents, they are catalysts, but it's people themselves that come to terms with the health issues, work out what they want, and exchange with health providers to get the best possible response. It's this public or whole of society embracing of health issues that absolutely is the key. In terms of quarantine and the effectiveness of quarantine, what really matters is that people need to be aware of their own physical health when they have been in situations where they might have been in contact with people with Ebola. And if they develop symptoms, particularly fever, joint aches, or other early symptoms of disease, then they need to isolate themselves from others and keep out of other people's way, and they need to communicate by telephone or other means to say that they are worried about themselves so that they can then be properly tested and put under treatment if necessary. Self-isolation is becoming the method of choice all over West Africa and in other places. Those of us who've been in and traveling in these regions become super aware, we take our temperatures regularly, and we are very responsible about what we will do. That is the ultimate. To put people into quarantine is saying we don't trust you to self-isolate and we need to do it to you. That's fine, but let it be done in a fully informed and responsible way where the person who's put into quarantine is fully engaged in the process and saying, I understand and I accept this. James King's point was also about quarantine, and James, very happy to have a conversation directly with you about this so that we can introduce the notion of self-isolation, self-awareness as part of the response. It's very easy to take your temperature, and it's something that we can do. It's easier if somebody else perhaps is reminding us to take our temperature, telephoning us saying, have you taken your temperature, what is it, so that there is a bit of peer support for it. I think that this is the way forward. Essential services undermined simply if I have had an accident and I am in a district in Sierra Leone and I want to get health care for it. It's very difficult at the moment. Health services are not working. If I am a woman who is pregnant in Monrovia and I want to get help because I've got delay in second stage of labor, it's very difficult to get that care. If I am a child and I want to be sure that I get my pneumonia or diarrhea looked after and I'm in a rural area in Guinée forestière, c'est très difficile de trouver quelqu'un pour m'aider. It's very difficult to get treatment. So all I'm saying is essential healthcare is not working. A lot of essential services for poverty reduction are not working. Agriculture has been disturbed, and other key parts of government are not working. So that is where I'm trying to be sure that we focus, and that's part of our response from the UN system. It's part of what governments are doing, like Franklin suggested, and it's part of what the world needs to do. NGOs have a key role to play. Is media getting accurate information on transmission? There is very good information available on websites about what contagion actually means. If that message is not getting through, then I think all of us who are in contact with media can be helpful. It's as I say, it's the second, third, fourth time that we look at the information that it starts to get in, and that's the time when it works. Are we going to see investments in better healthcare infrastructure in the future? Ladies and gentlemen, that is the key. Healthcare matters. It matters for, it's a human right. It matters for personal productivity. If you're sick, you can't work in your land and your fields. If you're sick, you can't do your studies. So healthcare matters for productivity. Healthcare matters for ensuring that women are able to look after their children. Healthcare matters as a means of security because diseases are a source of insecurity. Investment in better healthcare is the key. Governments can't skimp on it. The world cannot skimp on it. And one of the things that we all need to learn is that that is vital. Is there going to be better support for malaria and for other diseases? Yes, yes, yes. Please, all of you, use all your lobbying to make sure that malaria, tuberculosis, HIV, and the neglected tropical diseases get the attention they deserve. Use the current Ebola outbreak to ensure that everybody focuses on ill health. There's a lot of people dying all the time of malaria, and we need to make sure that that is also given adequate attention. We could take a couple more questions, Ramu.
Thank you so much, sir. Anyone else? Moment. Sorry. Yeah, please, sir. Yeah.
Hi, my name is Daryl Armstrong. I am with the Baptist World Alliance, and dear friend Reverend Sam Reeves is the pastor of the Providence Baptist Church in Monrovia. I am curious about the role of faith institutions, houses of worship, as being sites and potential centers for treatment and or dissemination of information. How are we using our houses of worship?
Thank you, Mr. Armstrong. Anyone else? Moment. Yes, please, ma'am, please. Yeah. Mm-hmm.
Yes, my name is Michelle Morick. I'm with the NGO Unanima International, and I wonder what progress is being made, if any, to get the experimental drugs that are being used in the United States into Africa. Thank you.
Thank you. Please, sir. Yes. Yeah.
Hi, my name is Samuel Davis. I'm a Sierra Leonean American who recently just traveled back to New York. And basically, I really want to know what's going on as far as with the UN towards education, because I've been in Sierra Leone for the last year and year and a half or so, and there's no schools, nothing's open. Kids are just running around doing nothing basically because of Ebola. So I want to know what steps are being taken to cure that.
Thank you, sir.
Thank you very much indeed. Reverend Armstrong, I think you're there in the back. The faith groups are absolutely key. Christian groups, Muslim groups, other groups in the region and beyond. They are key as places for sharing information. Faith hospitals are key as places for treatment. And also, it's necessary at times to recognize that in a place of faith, there can also be transmission, so there needs to be careful understanding of how to avoid transmission, particularly reducing contact. And I personally have advocated for the fullest possible work with an involvement of faith groups. I think if you get evidence that we in the international system are not doing enough on this, please call on me. And if you find it would be useful to have a special session with groups of faith, perhaps we could do that. I would certainly be delighted if you or anybody pulls a group together so that we can actually sit. And I've already done this with the World Council of Churches in Geneva, but we might find it useful to do something here, or also perhaps to do something when I'm next in the region. So thank you for that reminder. Thank you for all you and your people are doing in all groups of faith. Michelle, on the experimental drugs. I think that I want to talk about two things. The first is experimental vaccines. We've got two candidates. There is really strong efforts to fast-track the clinical trials. I anticipate that there will be vaccines available next year. Secondly, on drugs, we've got various drugs that are coming from the plasma of treated people. ZMapp is one example. There's another drug also being developed, or two drugs that are being developed, one in Japan and one elsewhere. The Japan one is a slightly different style of treatment. There is massive effort to try to scale up the production of these drugs right now. And I think that the key point that you raised is make sure that these experimental drugs are available in Africa. Please make certain that you're making representations of this, particularly if you have chapters or groups in Geneva, into our World Health Organization, so that when these issues are debated at the WHO Executive Board in January, there's a strong statement from civil society groups that the key point where these drugs are needed is where people are hurting, and so let's try and do it. But I take your words, it's something I believe in very strongly. And then lastly, Samuel, education. Couldn't agree with you more. With Tony Lake, the Executive Director of UNICEF, who I'm seeing again about this over this week, and also with Madame Bokova, the head of UNESCO, we are wanting to do what we can. It's really difficult because at the moment, schools in the affected countries are being used as temporary centres for care of people with Ebola. So it's something that as soon as we can get this outbreak better under control, then we must get the schools restarted. I agree with you, it's bad for the kids that are not in school. Some kids have lost at least a year of schooling as a result of this, and so as part of the recovery, education must be put very high on the agenda. So many things to deal with. Thank you very much indeed for being here. I hope you found it useful. I hope you'll keep the lines open to us and keep work. We are your United Nations. We are United Nations for the people of the world. So keep informing us if you have concerns, and don't hesitate either to Ramu or to myself to send in any comments or questions. We'll do our best to keep the lines open. Thanks again for the time.
Thank you so much, sir. I'll now ask the chair of the NGO DPI Executive Committee, Anne-Marie Carlson, please. Anne-Marie. Yes.
Yes, thank you, Ramu. I would like to announce that the Executive Committee will be holding a special meeting on Monday, November 24th. Now, that's a week from this coming Monday. Again, Monday, November 24th from 10:30 to 12 noon. This will be at the Baha'i Office Complex at 866 UN Plaza, Suite 120. That's the northeast corner of 48th Street and First Avenue that the Baha'i office is located. The Executive Committee will be sharing some recent developments and some other news that we feel you're going to want to hear. It's a special meeting, and all NGOs, please come. Again, Monday, the 24th of November at 10:30 a.m. Thank you, Ramu, and thank you so much, Dr. Nabarro, for being with us this morning.
Thank you, Anne-Marie. The Secretary General, as most of you would know, wrote an op-ed on Ebola on Sunday in the Washington Post, and the last line was, "We must continue to fight the fire until the last embers are extinguished." And I think, Dr. Nabarro, you've shown us not only the horror of the fire, but of the lurking danger of the embers that might persist, especially in your remarks about the post-Ebola scenario. We're immensely grateful. Thank you very much for joining us, and please be assured you have this vast array of civil society organizations, both present here and the constituencies they represent, to be with you in your struggle. Thank you very much, sir.
Okay, great.